So you're welcome to this session. And this is a session in public health pharmacology or pharmacology in public health. We are basically looking at the impact of drugs on on population health outcomes. So one of the areas we are going to look at is what we call irrational use of drugs. In the hospital, when we have patients visiting, the clinicians often have to collect information from these patients by taking their history and then also performing physical examinations, then taking them to the laboratory to obtain some samples and do some tests, and sometimes also request for radiological imaging. All these procedures basically are aimed at making sure that the clinician has sufficient data to be able to make a clinical diagnosis. And then upon this clinical diagnosis, the clinician will now prescribe the appropriate drugs to manage the condition. Okay, so if the appropriate drugs are given to the patient and the patient uses them as ordered or as instructed, based on the relevant evidence available or guidelines or protocols available in order to meet the patient's need or the patient's need for that particular drug, then we are saying that those drugs are being prescribed rationally. That is a rational use of drugs. Drugs are being used in the most appropriate and responsible way based on what is known in terms of evidence, in terms of protocols, in terms of guidelines to meet the patient's health needs. That's what we call rational drug use. It is very important that drugs are used in the appropriate way because one, that means that the patient is actually going to receive the right medication for the right condition, and is going to take it at the right time and also in the right dosage. Okay, if the appropriate procedures are taken. And therefore, if the drug has been taken in the correct way possible, then you're going to minimize the risk of having adverse effects. And you're basically not going to misuse resources because you're prescribing drugs for the right reason. Okay, so that is optimal use of drugs. And therefore, you minimize costs, adverse effects, and the patient is going to improve. But of course, it doesn't often happen like that. Sometimes the drugs are not used in the appropriate way. How? When a patient has a minor illness and then we prescribe a lot of drugs for this illness, it's not that all conditions actually need a prescription, but sometimes people over-prescribe. Sometimes it can be an issue of under-prescription. Or the prescription is not for the right condition. Okay, that is inappropriate. And then also, the drugs are actually being prescribed for the right reason, and perhaps someone else also uses those same drugs for another reason that is not appropriate. So they can be misused in that. So what is very common in practice is that often clinicians will prescribe antibiotics for almost every condition. You have a cold, an upper respiratory infection, That is perhaps caused by a viral, by a virus, okay, caused by a virus, but still you get antibiotics as a prescription. Someone is saying they have pain, and then you go for the strong opioids. So that means that the drugs for pain have not been used appropriately. There is a ladder that has to be followed in increasing or in moving from one type of painkiller to another. Okay, sometimes a lot of drugs are prescribed for one condition, that is polypharmacy, a number of different medications with no proper reason for actually prescribing them. Okay, and then also not looking at the patient characteristics in prescribing the drugs. The patient can be an elderly patient, or a pediatric patient, or a patient who has a chronic condition that is maybe affecting the kidneys or even the lungs or even the liver. So these are factors that have to be put into consideration before the prescriptions are made. We have what we call over-the-counter drugs. These are drugs that you can take without the need for a prescription. Still, they can be misused. Okay, they can be misused. People who use painkillers indiscriminately or even cold medications, this can actually be issues. So over-reliance on over-the-counter medications is not also good. So issues to drugs, for example, paracetamol, and other painkillers or headache relievers, cold relievers. Okay, these are these are examples of over-the-counter medications, and they should totally be used in an appropriate way. Okay, so sometimes the drugs can be combined. Okay, for example, the case we said of polypharmacy, someone prescribing many drugs for not for the right reasons. This actually have negative impact often. For example, these drugs may actually interact with one another and reducing the efficacy of each of the drugs. Okay, and then the risk of having adverse effects is also going to be increased. Okay, so it is not good to combine drugs not following the guidelines or the best level, the best evidence available. So why does this continue to exist? Why are people using drugs in ways that are not appropriate? One is that people don't have access to quality healthcare. So someone thinks about meeting the physician and paying for consultation fee as a barrier. Okay, so instead of having a medical consultation, they would rather go and ask for the medication, or they can use any medication that they find around them. Okay, and then lack of access to quality healthcare is also related to lack of or inadequate healthcare infrastructure. Okay, so that also makes it difficult for people to always get the appropriate health information about the drugs before they can use. Some people are not aware that these practices are not actually good, so they have limited knowledge. And then some individuals may prefer to sell drugs even when they are not the appropriate drugs to be taken because of the financial incentive associated. Maybe they get more money by selling the particular drug, even when there is no indication for it. Some patients actually claim that they do need to be treated with certain medications, even without the proper indication for them. So it is important for us to realize that issues to do with training of health professionals, whether doctors, nurses, clinical officers, midwives, is very important, such that they understand the importance of prescribing drugs in a rational way. There are also market factors influencing prescription practices. Okay, pharmaceutical companies could be interested in selling particular drugs, and they can approach clinicians who will then prescribe these drugs to increase the number of sales. Okay, so this is related to financial incentives, but also having a health system that is weak and fragmented makes it difficult to actually control irrational use of drugs. It is very important that there is a robust drug regulatory mechanism to be able to regulate the use of drugs. We, for example, have what we call the control drugs. It is very important that there is strict rules on importation and use of controlled drugs, such as opioids, morphine, and others. So if we don't use drugs in the appropriate way, that means that the healthcare system is going to spend a lot of money on procuring drugs that are not being used on the right patients for the right reasons. So that means that there's wastage of drugs, and also it is also likely that we'll have adverse events related to the drugs. Issues of drug resistance will come up, and patients will not actually have optimal health outcomes as a result. But definitely, it drains the resources from the health system, because we are using drugs for not for the appropriate reasons. So the health workers can be a target in trying to improve rational use of drugs. They should be educated on using evidence to prescribe medications. That means that if there is no reason for prescribing certain medications, then don't actually prescribe them. But they also play an important role in educating the patients as they are giving them the medications. But also monitor the patient's responses and adherence to the drugs. And if the conditions actually persist, then it could be something that warrants public health attention. And also aspect in the review of medications, and also make sure that they are optimally used. So we have what we call optimization processes in drug use. To also improve on drug rational use, you can institute what you call educational strategies targeting the health professionals, such that they really understand the rational use of drugs. Issues to do with them understanding the treatment protocols, the prescription guidelines, the latest research on the different drugs available. This is very, very important in improving rational drug use. At the management level, you need to ensure that there are guidelines and protocols, or even quality assurance programs that promote rational use of drugs. So that means that in terms of procurement at the managerial level, the drugs that should be available should be those in formulations that are actually optimal in terms of safety, efficacy, and also cost effectiveness. And also, as a manager, you need to be able to disseminate different guidelines and also train people on prescription practices. And another way is to ensure that economic strategies are implemented. This is to say that the access to the appropriate drugs is actually influenced by economic status. Using generic drugs is often important, and also price regulation are very key in making sure that people actually receive the drugs that they ought to receive. This is basically to say that you remove the economic barrier to access to the appropriate drugs for the patients. Regulations are also very key. Regulatory policies are very important, and they should actually be implemented or enforced. Okay, and there should be penalties for illegal drug use or even drug sale and distribution. Now we move to one major problem that happens is what we call drug dependence and substance abuse. This happens when an individual physiologically, psychologically, and physically rely on drugs or substances that actually have harmful effects on their bodies, social well-being, and also function. So this is actually this, you can just call it the mental disorder, where you have someone relying on drugs for them to be able to work for their social performance or work performance. So generally, their well-being. This is not something that is actually good. So what causes this? Of course, there are many factors. There is genetic predisposition, environmental factors, psychological reasons, social factors. All these actually make an individual prone to using substances. We have a number of drugs that can be used for abuse or substance abuse. So we have opioids, stimulants, sedatives, hallucinogens, alcohol. These are examples of drugs or substances that can actually be abused. So it is very important for us to be able to diagnose someone who is abusing drugs. And the diagnosis is based on a number of parameters, including physical and psychological symptoms, their ability to function, and then also presence of withdrawal symptoms. Okay, we can use the DSM-5 as one of the diagnostic criteria to diagnose an individual with substance abuse. Individuals with substance abuse need to be managed in a comprehensive way, because we are going to deal with issues to do with the physical, psychological, and social aspects of this drug abuse. So that means that you're going to have a combination of interventions that target all these aspects. So you're going to have pharmacological interventions, counseling, behavioral therapy, support group, and life modifications. But generally, it is very important to understand that managing an individual with a substance abuse problem needs a team of individuals or team of professionals, including health workers, psychiatrists, psychologists, social workers, and also support networks. It is very important that detoxification takes place. They are rehabilitated and also put in situations where they cannot relapse, and then continuously provided with the necessary support to be able to recover. Thank you very much. So that marks the end of our presentation.